Welcome back to the Science of Turning Back Time. Today we are joined by Dr. Noushin Hart, a board-certified radiation oncologist with more than 3 decades of medical experience. While her career began in conventional medicine and oncology, her work has evolved to explore something we're increasingly interested in, and that's how our emotional experiences, nervous system, and lifestyle can shape our physical health over time. Drawing on growing research linking adverse childhood experiences and chronic stress with inflammation, immune dysfunction, and chronic disease, Dr. Hart takes a trauma-informed whole-person approach to prevention and recovery. Her work now brings together her medical background with nervous system regulation, lifestyle medicine, and approaches including the MAP method. And today we're going to explore the fascinating connection between trauma, the nervous system, chronic disease, and resilience, and what we can do to influence our health before disease develops. Dr. Hart, welcome to the podcast.
Thank you so very much. Thanks for having me.
And if you can tell our listeners where you're joining from today?
I'm joining from Houston, Texas.
Fabulous. So, can you tell us a little bit about your journey and what's brought you to where you are? So you've gone from a very classical Western medicine background to becoming more interested in the effects of trauma on our physical health. Can you tell us a little bit about that journey?
Yes. So I'm originally from Iran. I finished my medical school in Iran. I had some political activity during revolution and afterwards, and they did not allow me to do my residency in Iran. And that is one of the reasons that I emigrated to the United States. The other reason, obviously, was that the women were very suppressed and I could not take it anymore. So in 1994, I came to the US and did my residency in radiation oncology. I had to repeat a year of internship because I was a foreign graduate. And it was during my internship that I developed insomnia. I couldn't sleep. And part of it was attributed to my very difficult call schedule. I literally had to be up for 36 hours and then sleep at night. And naturally, I said, "Oh, my sleep schedule is like so bad. I'm going to go to a psychiatrist and they're going to give me a pill and it's going to be fixed." Giving credit to that psychiatrist, when I went to them, they put a long questionnaire in front of me. And one of the questions was whether I had been sexually abused. And for the first time at age 34, I was admitting to another human being that I had been sexually abused. And when the psychiatrist suggested that I needed at least 7 years of therapy, I thought she was absolutely crazy because on the surface, I thought I was fine because I had suppressed all of those emotions so deeply that I was absolutely in no touch with them. And I was telling her, like, look at me, I'm like so good. I can tell you the story without getting upset. And she was like, yeah, exactly. You have no emotion attached to them. And we have to dig all of those out. And those 7 years turned into 30 years of therapy, heavy doses of medications, and I only got worse. And all those 30 years, I was very loyal to Western medicine and what it had to offer me until my psychiatrist, this was psychiatrist number, I don't know, 5, because I was moving from city to city as I was going through my career, and said, I have nothing else to offer you. And that was very shocking. But looking backwards, it was my liberation from the box of Western medicine. So up to that point, I would not accept any offered treatment if there was no data or research backing it up. But at that point, I had no other choice but trying things that had no data or research. So I started trying things that many of them didn't work, but two of them literally saved my life. And I'm sorry for this long answer to your simple question, but it was a positive things at the end, because not only I was able to heal my childhood traumas, then I became an open-minded oncologist, and literally being reminded that my own patients needed to address their childhood traumas.
It's a very powerful story, and I think it is often through our own learned experiences that we begin to practice in a different way with our own patients.
Yes.
And yeah, it is a very powerful story. And I think, what I've noticed in practice as well is, especially a lot of my patients that come in with very complex and chronic health conditions, very often, when you trace that back, there is an element of quite significant trauma
Yes.
in childhood, which people very often don't recognize. And, what do you know about what they call the ACEs? Maybe you can explain a little bit what they are,
Yes.
but also how they impact our physical health.
Adverse childhood experiences, or ACEs, they were published several decades ago. And there's 10 simple questions that anybody can find online and answer for themselves and see what their score is. My score is 7, significantly high. And that study and a follow-up study on ACEs showed that people with high ACE scores had many-fold higher risk of many physical illnesses. Aside from higher risk of addiction and suicide and all of that, aside from, depression and all kind of mental issues, they have physical illnesses such as asthma and obesity and diabetes and heart attack. And I'm getting goosebumps now, because as I was going through my own healing and learning about ACEs, I'm like, what? I never ever in medical school, in residency, learned about ACEs. Nobody told me about the correlation between ACEs and these physical illnesses. I have never been asked as a patient by my doctors, regardless of their specialty, and I have never asked any of my patients up to that point, what is your ACE? It seems to be one of the most critical questions to ask. And it's mind-boggling that this very significant scientific correlation between adverse childhood experiences and our mental and physical illnesses is not discussed in a visit with your doctor.
Yeah, absolutely. And I think for a lot of my patients, when I bring up trauma, they're very dismissive, as you were yourself. And I know for myself, I was also very dismissive, that I didn't have any. It's only when people go and fill in that, look at those questions and actually fill in those forms, and then you suddenly begin to see, oh, hold on. It is quite, I think there are a large number of, I would say, my patient population who definitely end up with scores a lot higher than they think they would, and until they've done the scoring.
And I think what is still unaddressed besides ACEs is that we have 2 types of traumas, and Dr. Gabor Mate very beautifully describes them as trauma with capital T and trauma with lowercase t. Traumas with capital T or ACEs, bad things that happen to you, sexual abuse and this and this and that. And when we talk about trauma, often people say, oh, I didn't have sexual abuse in my childhood. I wasn't beaten, whatever. But trauma with lowercase t is the positive things that we were supposed as a child to receive and we did not receive. Every child
No.
deserves to be seen, to be heard, to be loved unconditionally. And many children don't have that. And Dr. Gabor Mate famously says, give me any person who says, I did not have childhood trauma. Give me 15 minutes with them and I'll show them what their childhood trauma is. So in addition to the fact that even when we have trauma with capital T, we are dismissive like I was, there are people who have trauma with lowercase t and they don't even consider it trauma.
That's very, very true. I wonder also, are you able to give some kind of explanation of how it impacts health? So, from the research, we certainly know that there is this connection between higher ACE score and physical health. But do you know what the mechanism is, or
Yes.
Yeah.
The mechanism is chronic inflammation. So inflammation, the acute type of inflammation in our body, is a part of our immune system. When I'm exposed to bacteria and I develop fever, chills, sweating, fatigue, that is my immune system's response to something that is not supposed to be in my body. And all of those inflammatory responses are to protect me and to fight the bacteria and make me better. And then once the bacteria is killed, I return to my usual self. There's no inflammation. And that might take few days. Now, with trauma as one of the examples of factors that causes chronic inflammations, but there are other factors such as sugar and toxins in our food and air and water. What happens is that our adrenals are stimulated to pump cortisol in our system 24/7. And specifically talking about trauma, our hypothalamus stimulates our pituitary gland, and then pituitary stimulates adrenals because we are in a state of survival. We are in survival mode. So our hypothalamus will say, danger, danger, danger. Something is threatening the system, our life. So we are like that deer that is running from the lion, but is not for 30 minutes, is for 30 years. And the reason that I couldn't sleep for 30 years, I literally dealt with insomnia for 30 years, is because my sexual abuse was happening in my bed at night when I was sleeping. So I closed my eyes thinking that it's time to rest. My hypothalamus is saying, it's really bad time. It's
Not
bad
safe.
things are going to happen right now. And I'm hyper vigilant and cortisol is being pumped in my system and I cannot go to sleep. So chronic inflammation is really, really bad for us. And now science is recognizing that chronic inflammation is linked to many serious illnesses, including dementia, including multiple sclerosis, including cancer. And that is how trauma, childhood trauma, adulthood trauma is linked to physical illnesses.
I want to pick up on one thing that you said there as well. You were talking about, trying to fall asleep and your nervous system saying like, hey, hold on, what are you doing trying to sleep? And we have to be running. Ultimately, I do believe that it is just it's your nervous system's way of trying to protect you. And I think it's a very powerful way to see it. Instead of your body kind of working against you and fighting against you, to know that all these things, these responses are happening because ultimately your body is trying so hard to protect you and keep you safe.
Absolutely. These are all adaptations to an environment which was not safe. And if we did not have these adaptations at that age, we would not have survived. So we have to be grateful to these adaptations. However, now, as an adult, when we are not in that environment, they are not serving us anymore. So we have to learn a way of stopping those adaptation modes now.
I often will see patients come in and they're doing all the right things. So they have, let's say they have some kind of inflammatory condition and they're on an anti-inflammatory diet and they're taking all the right supplements and they're really like they're doing everything right. They're exercising, they're looking after themselves, and just not getting better. And often I think that trauma element can be a part of it.
Yes.
I also see people who, very much like you said in the beginning, have gone through decades of counseling and medication, and they're just still not moving through all of these things. So, is there a map through this? Is there a way through all of this that we can actually escape from the
Yes.
effects of trauma?
So trauma literally wires your brain a certain way. And until you rewire your brain a different way, you are not out of this pattern.
Yeah.
So it's a neurological imprint. So I use analogy of a GPS. If you set your GPS to always use the highway, every time you enter an address, your GPS is gonna skip all the shortcuts and it's gonna take you through a highway and vice versa. Now, if you reset your GPS and you just show me the short or avoid highways, it just completely gives you a different direction. That's a simplistic way of saying it. But patterns, like one of the patterns I had was that I would fall in love with abusive men. I was just attracted to abusive men because I have 3 abusers who were men. My brain was wired. I would identify abusive men and I was attracted to them. And until my brain was rewired, that was my pattern. And that was one of only many patterns. And there are different ways of rewiring your brain. And MAP is one of them. Make anything possible. When 30 years of therapy made me only worse because I had to re-traumatize myself by retelling my traumatizing stories to one therapist after another, because probably just like your country, US is a very dynamic country. As I finish my internship, I'll go to another city for a residency and then go to another city for my first job and then go to another city for my site. My therapies are changing. So I have to start all over telling all of my stories and I would get re-traumatized. When 30 years of therapy made me only worse, six sessions of MAP neutralized my childhood trauma because there is no storytelling. It is done at subconscious level and it is done by your own higher self. The role of a MAP coach is to communicate with your higher self through muscle testing. And once you do your MAP sessions, then the coach teaches you what is called MAP on the go. You literally can do MAP on yourself in case you get triggered by something. So MAP literally rewires your brain. So these poor people who are doing everything right, their GPS is set a certain way. And there's still, the chronic inflammation is still there because the system is fighting against everything else that they're doing.
If I'm understanding this correctly, because usually with kind of talking therapies and things, we're using, it's that kind of very cognitive part of our brains, but you're talking about muscle testing. So you're talking about a body response to rather than a kind of cognitive response, a body response. Am I understanding that correctly?
But muscle testing, first of all, muscle testing is really simple, and I recommend everybody learns it because our higher self can answer every question very accurately by a yes or no. And I know of parents who are now teaching their children this. And it can be done either by the simplest way is that say, I want to decide whether this supplement is good for me or not. Just put it on the table and stand in front of it. Close your eyes, relax, and ask, is this supplement good for me? And your body, if the answer is yes, automatically leans forward. Your entire body leans forward toward the supplement. The answer is yes. And if the answer is no, your body leans back. So with this is a form of muscle testing. You can get yes and no answers about many things, okay? Now, if you don't want to do that in a grocery store and people looking at you, it's like, what is she doing? You can do it with your fingers. You can create a loop, yes. And then you can decide, some people decide that, generally speaking, yes is when the muscle is strong. Generally, when the muscle is strong, your higher self is saying yes. And when it's loose and goes, your finger goes easily through the loop, the answer is no. So you can do that for yourself, or you can do it for somebody else. And in fact, if you're muscle testing to get answer to a question that you're really attached to the outcome, it's better to have somebody else muscle test.
Yes.
For example, if you're in love with this really abusive man, like I used to be, and because of this very traumatic, pathological attraction, you don't want to break with this guy. When I do if I did then muscle testing, I want the answer to be no, don't break up with the man. And I'm going to get a no, right? Because I'm attached to that. So you want to do that. You want to have somebody else as a surrogate do that to get the real answer from higher self to say, yes, break up yesterday. So people can do muscle testing for you. Now in MAP, because the higher self of the client is the guide, the higher self of the client decides how to move through this very comprehensive chart that MAP has. That has, sometimes the higher self of client wants to take me to their chakras. Sometimes it wants to take me to their meridian. Sometimes it wants to take me to what is called parts. That is a term used in internal family system, which is us at different ages when we were traumatized. Noushin at age 4, Noushin at age 5, Noushin at age 6. And each one of these Noushins, which is like a kindergarten inside of me, they assumed a role. The Noushin at age 4 might be this funny clown that wanted to get the love of her caregivers by being funny. The Noushin at age 5 might be this really mad, angry little child that was defending herself by that. So now they have assumed this role to keep Noushin alive. And Noushin at 65 still is being her life is being run by these 4 and 5 and 6 year old. These are parts. So to get back to muscle testing, when I connect to higher self of client, of course, with their permission, I muscle test, should I go here? Should I go there? Should I end the session? Is their higher self doing the work of the healing? Is their higher self doing the rewiring of the brain? Is their higher self guiding me through this chart? I am just a facilitator. And that's the beauty of MAP. because it's really healing is happening by higher self of the client, not me. I'm just a facilitator.
There's a lot of things there that I want to unpack, but the first thing I really love is that shift away from giving the power to your doctor, your therapist, your practitioner, or whatever, where you go in and you're like, okay, here, what do I need to do? Or, and for them to make that sort of judgment and decision. I'm the expert. I'm going to tell you what to do. What I'm loving about this is really honoring what, you know, honoring yourself and trusting yourself, because I think a lot of the time we lose a lot of trust in ourselves. And we lose a lot. People lose trust in their bodies, and they lose trust in the process, and kind of need an expert and need, to give them that advice. And it's kind of going back again to saying, listening to their own bodies, because nobody's going to be more of an expert on you and your health and your body than you are. So it sounds to me like tapping into that higher self is a very, very powerful way of really learning to work with our own, with our own bodies, rather than getting that external kind of expertise.
I 100% agree with you. I used to be this very dependent person on outside sources, like especially when it came to making decisions. I wanted the decision to be perfect. I make columns of pros and cons, and if they were kind of equal, then I would ask 10 other people, what should I do? What do you think? And with the best of intention, they give their opinion, but that was not perhaps the best thing for me. So I make a lot of bad decisions. And through my own journey of healing, I reached the conclusion that healing for me meant reconnecting to my intuition and reconnected to my body. I was completely disconnected from both. And when, after 6 sessions of MAP and the other modality called CAP, I found myself that I have no question for anybody else. I have answers to all of my questions. I can make decisions, much better decisions, completely independently of others and independent of my brain, because it was based on my intuition. I would just wake up in the morning. I know I have to make it right. And I couldn't explain it for myself, and I couldn't explain it for anybody else, but I knew it's the right thing to do. And that trust, it's so liberating. And our bodies, just imagine, just these days, look at how many contradicting studies are out there.
Yeah.
Eat this, don't eat it. This is good for you. No, it's not good for you. And then all this social media driving you absolutely crazy about supplements and food and all of that. My body guides me. And if you listen to your body exactly tells you what you need to eat, what you should not eat. And my body is different from you. There's no one size fits all. We have to listen to our body. So this is the most important factor for me when it comes to my clients. And it is a trauma response to want to be dependent on someone. The moment my clients, I see any sign that they want to become dependent on me, it's a no-no. And I say it from the get-go. I'm gonna empower you through MAP or CAP or whatever for you to reconnect to intuition, to your body. I never tell them how many CAP sessions they have to do. I say you have to learn, and I guide you to get answer from your intuition. That is absolutely my goal.
I really love that. And I love that because I think also I see so many people very disconnected from their bodies.
Yes.
And I think what it does is creates a reconnection and that building trust again, within ourselves, because, I, I think we've learned so much um, to disconnect and listen to this external advice, like you say. So I'm really curious, right? If you could take today's interview and play it to yourself 30 years ago, what would you think?
30 years ago, I would have probably dismissed everything about it. I was like, what are they talking about? And I would have said, okay, show me data. I was like, what is it? Well, and thankfully, there was data. You could have shown me data about
Mm-hmm.
ACE, and perhaps you could have woken me up way earlier than I woke up. So none of the things that we are saying is non-scientific. I just had not heard about it.
Mm-hmm. Interesting. Okay, so there's a second method that you are referencing called CAP.
Kundalini activation process is based on the fact, very scientific fact, that we are all made of energy. We are made of atoms. And we know scientifically that the particles, we call them particles in the atoms, electron, proton, neutron, they are not material, they're energy. So we are energy. So anything that is made of energy has a certain frequency, has a certain vibration. So our emotions have a certain vibration, our thoughts have a certain vibration, and our state of health or disease has a certain vibration. Anything that has a low vibration is usually incoherent and is not good. So disease usually is low vibration and incoherent energy. Now, health is usually very coherent and high vibration. Depression is very low vibration, incoherent. Joy and natural state of happiness, which is our natural state when we are born. Babies are all happy and kids are usually happy and joyous. That is high vibration. So Kundalini energy is life force energy, is your energy, is not mine. We all have it. And because we all have been made of one consciousness, that energy is shared between us, is the same thing. It's non-duality, right? We are all made of the same consciousness. Now, for the most part, in the majority of people, that life force energy is dormant, is not activated. So the goal of Kundalini activation process is to wake that life force energy up. And the outcome is like, for me, was like all of a sudden my life was black and white and it became colorful and I came alive. And the only thing that happened, which is very significant, is that I was at a very low vibration state, emotionally, mentally, physically. And I came up here. And when you go from low vibration to high vibration, spontaneous healing happens without intervention. So very shortly after doing CAP, and of course I was doing MAP, 6 sessions of MAP around the same time, I came off all my medications. I stopped therapy. I started sleeping like a baby. I was the happiest I was in my life, as if I had never ever had depression. Completely different person. And that can happen for anyone with any disease. Because this person with low vibration who had whatever disease is here, when you are here, you're not that person anymore. And that's how spontaneous healing happens.
I love that. So my next question was going to be around if we know that ACEs contribute to the development of certain conditions, if we work through resolving that trauma, does it mean that we can reverse those conditions? And I think
absolutely,
yeah.
Absolutely, absolutely. I want to emphasize on this because for the longest time, as I was going through 30 years of failing treatments, and especially when my psychotherapist said, I don't have anything to offer you, I thought I was damaged good, and society thought of that. If you had sexual abuse and childhood trauma, you were damaged good. There was no way that we could remove the effect of the significant negative effect of your experiences and make you a person as if you never had them. I am the person who as if I never had them because my brain has been rewired. I remember them, but I don't have the negative reaction. And now not having the negative reaction is very different from 30 years ago with the first psychiatrist that I'm like, I'm fine. I don't have a negative. I have dealt with them. I have experienced those feelings. And now I literally don't have them. I have forgiven my abusers. And that is not a requirement. If you don't want to forgive them, don't. But I feel better. I have forgiven them because I know they were traumatized and that was their response of their trauma. Abused people either become abusers or learn from their trauma and become compassionate people who can use their wisdom to help other people who have been traumatized. So yes, absolutely. The answer is yes.
Mm-hmm. Wonderful. Thank you so much for joining me today. I think that's been a wonderful conversation, and I think it's probably going to resonate with a lot of our listeners. So for anyone who's interested, there will be the link below with a little bit more information if this has sparked some curiosity for you. But Dr. Hart, thank you so much for your time. Incredibly grateful for a really, I think, compassionate conversation around trauma, but you brought so much lightness to it as well. You'd see a lot of laughter and joy that came through this journey for you as well. So, just giving people a map through this, through the process, which is very valuable. So thank you.
Thanks for having me. I really, really, the only thing that I want to tell people is that there is hope. Because just a few years back, I was completely helpless and I thought there's absolutely no hope for me. And I want to go and scream from the top of the roof and tell people who might have been or are where I was several years ago, please don't give up. There's absolute hope. You can be healed completely as if none of these bad things have happened to you. You have so much power inside of you. And with just a little bit of guidance and help, you can be an absolutely new person.
I love that. And I think it's probably a message that a lot of people out there do need to hear.
Yes.
So thank you so much
Thank you.
for your
Thanks
time.
for having me. Thank you.
If you would like to learn more about how we can help, visit our website at www.charmaine-shepherd.com. And finally, if you have enjoyed listening to the show, please subscribe and rate it. Thank you for listening.